It seems like it's been 40 weeks since you got 40 winks. Your back pain? Unbearable. Tossing, turning, trying to find that pain-free position. And that's the moment you realize you can't spend another waking moment putting off treatment.
The Joint and Spine Center is Cincinnati's leading destination for spine care, with a ton of surgical and non-surgical treatments for back pain. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better, the Christ Hospital Health Network. This changes everything.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 662, Pelvic Floor Health with Urogynecologist Aparna Shah.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine. I am very excited to be joined by my guest, urogynecologist at the Christ Hospital, Aparna Shah. How are you?
Hi, I'm great. How are you?
Good. So I am... This is a weird statement. I'm so excited to talk about pelvic floor.
Well, me too. So it's perfect.
Yay. So I know for me, as far as having this podcast and on social media and stuff like that, a lot of people have said that they wanted to hear a podcast, a conversation about pelvic floor. A lot of women talking about, having to pee a little when they don't want to. And then after having kids, and I know working out at the gym, a lot of women are concerned about what level of exercise can they do without feeling self-conscious or uncomfortable. So I kind of wanted to just go into all of that here in a second. But first I want to hear about, how did you make this your career, and how did you end up at the Christ Hospital?
Yeah. So my background training is that I'm an OBGYN. And then urogynecology is a fellowship that you can do either out of a urology residency or out of an obstetrics and gynecology residency. So I trained in obstetrics and gynecology in Boston. And I started out wanting to be a cancer doctor, so a GYN oncologist. But during the course of my training, I just realized that emotionally it was harder for me with sort of sicker patients. And what I really enjoy is sort of quality of life. I've always been passionate, at least going back to medical school, about women's health care. And kind of what I learned about myself during the course of residency was that I like taking people's problems and fixing them. And I'm really interested in women's quality of life, especially as women get older. And so that kind of pulled me away from GYN oncology a little bit, just where I found that really emotionally hard, and kind of towards urogynecology, which is just really focused on improving quality of life for women. And it's kind of a happy field because we take people's problems and we fix them.
Yeah, that's awesome. So what exactly is the pelvic floor? I feel like that's a term that you hear a lot, or you have a weak pelvic floor. So what exactly is going on there? What is it?
Yeah. No, that's a great question. So when we talk about the pelvic floor, often what people are referring to is a layer of muscles that line the pelvis at the bottom, kind of like a bowl. Mm-hmm. But really, when we talk about the pelvic floor, it's a whole lot more than muscles. So it's those muscles that everyone talks about when you say Kegel, you're squeezing those pelvic floor muscles. But it's also bony structures, it's nerves, it's connective tissues, and they all sort of form, like I said, this bowl at the bottom of the pelvis that support all of the pelvic organs. So your uterus, they also support the vagina, the rectum. So it's kind of like a supportive framework that's really a conglomerate of muscles, connective tissues, and bony structures.
So it seems like it has a lot of jobs.
There's a lot of jobs.
So I'm guessing that's probably reason why there can be so many different issues, is if something's going on there can a lot of roadblocks and things can happen.
Yep, absolutely. Lots of things can happen. And, as women, we do a lot of things that contribute to damaging our pelvic floor over a lifetime, right? So, things like chronically coughing, things like carrying a couple extra pounds, things like pregnancy and childbirth. So whether it's, vaginal birth or a C-section, just the act of being pregnant and carrying that extra that baby and the extra weight for all those months, chronically coughing. So lots of things we do contribute to damaging the pelvic floor. And as you said, result in a lot of different types of pelvic floor disorders.
So what are some pelvic floor disorders?
Yeah. So the most common ones that we deal with as urogynecologists are urinary incontinence, which is involuntary leakage of urine. So leakage of urine when you don't want it to happen. And there's different kinds of urinary incontinence. And we can talk about that in a minute. Pelvic organ prolapse is probably the other thing that I see in my office, multiple times every single day. And that's when any of the pelvic organs herniate into the vagina, and they can actually herniate out of the vaginal opening. So for women, it often is experienced as something like a vaginal bulge. But there's a whole host of other pelvic floor disorders. So, fecal incontinence, there's recurrent bladder infections, there's pelvic floor related pain syndromes. And we kind of deal with all of those, as well as like constipation, problems with defecation. They all kind of fall into the purview of a urogynecologist. We also do deal with like fecal incontinence. So that's involuntary leakage of stool. So really anything that goes wrong with the pelvic floor, that's kind of what we deal with.
So back to the urinary incontinence, because I feel like that's the issue that at least I have been asked a lot about. If you think you're at the gym, you're going to be jumping around, you're going to do some exercise, and you're like, I don't need that in my life to have an accident. So, what kind of things do you deal with that?
Yeah. So with urinary incontinence, women can get multiple different kinds of incontinence, but by and large, about 95% of what we see is either stress urinary incontinence, which is what you were kind of referring to. And that's anytime there's a physical stress on that pelvic floor caused by an increased pressure in the belly or abdomen, that leads to stress incontinence. So activities that might cause it, like you said, are for sure vigorous activity, running, any type of exercise really, but also simple things like coughing, sneezing. Sometimes women experience stress urinary incontinence during intercourse, lifting up a child or a heavy box or a heavy item. All of those things can cause stress incontinence, which is one of the most common types of incontinence we see. And it's the very most common type of incontinence is in younger women. As women start to get older, we see the other most common type of incontinence, which is urgency urinary incontinence. And that is the leakage when you feel like you got to go and you can't make it to the bathroom in time, and then you leak. And not everyone with urgency symptoms leak. Sometimes it's just really strong urgency and frequency, and that can be annoying with or without leakage. But by and large, 95% of what I see in the office is stress urinary incontinence or urgency urinary incontinence. And while stress urinary incontinence is the most common in younger women and urgency incontinence becomes more common, we see all of those types of incontinence in women of all different ages, going down to I've seen 15-year-olds and I've seen 95-year-olds. So, people sometimes come in and they're embarrassed or they're like, am I too young? And unfortunately, urinary incontinence impacts women at a variety of different ages.
So what's the root cause of that?
Yeah, so different kinds of incontinence have different causes. So with the stress urinary incontinence, which is that cough, sneeze, exercise type of leakage, that tends to be caused by sort of weakened supports to the bladder neck area and the tube that you pee through. And sometimes it's just caused by outright damage to the muscles around the urethra, which is the tube you pee through. The other type of leakage, the urgency, I gotta go, I can't make it to the bathroom, is most commonly caused by bladder muscle spasms. And that is often related to nerve damage to the bladder. And I'm really glad you brought that up, because it's really important to understand that these different types of incontinence have different causes, and therefore they have different treatments, because obviously we're targeting the problem in each situation.
So is that something where, is it affected by something like childbirth or like the coughing that you brought up? Or is it just something that can just naturally happen just because that's how your body's built?
So certainly pregnancy and childbirth are major risk factors for really all pelvic floor disorders, and for sure for urinary incontinence. Both stress incontinence and urgency incontinence are more common in women after they've given childbirth, but we definitely see women, like I said, across the age spectrum who have never had children who still develop one or both types of urinary incontinence. So while childbirth is a risk factor, you don't have to have given birth to a child or had a pregnancy in order to develop urinary incontinence. The way I like to think about it is there's multiple factors contributing, and while childbirth and pregnancy are huge contributing factors, there's other factors too. And what I always tell my patients is you can't fight genetics. And so there's definitely a genetic link as well.
Well, one of the things you brought up earlier was weight. So, I mean, how much of a factor is being overweight?
Yeah. So the issue with weight is that it puts chronic increased pressure on those pelvic floor support structures that we talked about. And so weight is definitely a risk factor for most of our pelvic floor disorders, and for sure for urinary incontinence and for pelvic organ prolapse. And the question of how much weight do you need to lose to eradicate your pelvic floor disorders? Well, there's no fixed number. Certainly in women who are obese or morbidly obese, coming down to a normal weight can be helpful. And certainly coming down to a normal weight is beneficial from a health perspective, for so many different reasons, but certainly it can only benefit the pelvic floor.
So for like me, I've lost over 100 pounds. So at that point, then for like me, where I am now, is my pelvic floor just kind of jacked up from being so overweight for a while? Or does it kind of like fix itself when the weight comes off?
Things can be fixed, right? So if that chronic increase in belly pressure goes away because you've lost 100 pounds, and by the way, congratulations, that's amazing. You may find that your cough sneeze leakage, for example, gets better. Some women may find that their overactive bladder gets better. So it's variable. There's no sort of definitive, if you lose this much weight or this percentage of your body weight, you'll definitely solve the problem. But like I said, certainly coming down to a normal weight is beneficial for your heart and for so many other medical reasons. And it will only benefit your pelvic floor. It's certainly not going to hurt your pelvic floor.
So can your pelvic floor be weakened without any of these symptoms and you just kind of don't know it yet?
Typically, people who present to my office have a pelvic floor disorder that is symptomatic. Are there people who can't, for example, contract their pelvic floor muscles, or who don't have control, who don't have symptoms? Certainly. In the end, though, what we're seeing as urogynecologists, we're specialists who manage pelvic floor disorders. So people who come to our office by and large have pelvic floor disorders. And, by definition, there's some damage to some pelvic floor structure in order for those pelvic floor disorders to develop.
So what are some of the ways that people can strengthen their pelvic floor?
Yeah, so that's a great question. So, we always talk about these Kegel exercises, which is really contracting your pelvic floor muscles. Pelvic floor muscles are great in the sense that they can be preventative. So, if we got every postpartum woman to do pelvic floor disorders, we would likely prevent or if we got every postpartum woman to do pelvic floor muscle exercises, these so-called Kegels, we could probably prevent a substantial portion of pelvic floor disorders. The other thing we find is that, though, even for women who've developed pelvic floor disorders, physical therapy and being trained to do those pelvic floor muscle exercises properly can be really effective at reducing symptoms. Generally, what I would say is pelvic floor muscle exercises are more effective for milder stages of pelvic floor disorders. So, once someone gets to me and their cough, sneeze, leakage is so severe that even just taking a simple step when they're walking causes leakage, that might not go away with pelvic floor muscle exercises. But, I take the, mom who only leaks during her tennis matches and doesn't leak during coughing, sneezing, or anything else. She might really be able to cure her pelvic floor disorder just with pelvic floor muscle exercises. Similarly, for a woman with a large vaginal bulge or prolapse, if everything has already herniated out of the vaginal opening, pelvic floor physical therapy isn't going to make that go back where it belongs. But for someone who has a milder stage of prolapse, so for example, maybe a mild herniation of the bladder into the vagina, but not past the opening, she might find that she gets slight regression of her bulge with some proper pelvic floor exercises. And she for sure might find she can get some symptomatic relief. So, i.e., while the bulge might not completely go away, the symptoms that she's getting from it might improve. So there's definitely a lot of value to pelvic floor disorders, both in the realm of prevention, but then also in treatment of milder stage pelvic floor disorders. I would add, we also use a lot of pelvic floor physical therapy for pelvic floor related pain syndrome. So different types of physical therapy, but again, a huge benefit from pelvic floor physical therapy when it comes to those pelvic floor related pain disorders.
So speaking of pelvic floor physical therapy, I have a little experience with that I wanted to kind of ask you about. So try to explain this in a friendly way possible, but we're all friends here. We can talk about what we're doing. So I was having like sciatic problems last year, and there was just like nothing was working. And so my physical therapist was like, I think that we need to work with your pelvic floor. And part of that, my exercises were basically to use my fingers to like relieve some pressure inside, like feeling where it felt like think clockwise motion and where in the clock things felt differently, and to put different pressure on different parts of the clock. Yep. And is that a common practice? And like, what exactly is that doing?
It sounds to me like what you had is what we call myofascial release. So as opposed to when we talk about treating cough, sneeze, leakage, or pelvic organ prolapse, we're talking about pelvic floor muscle contraction and strengthening. A lot of these pain syndromes are related to pelvic floor muscles being in spasm. And so it's a different type of physical therapy. And it sounds more like what you had, where the physical therapist will be working with you more to release the muscle spasm. So just simply going home and doing Kegels wouldn't necessarily be the right type of pelvic floor physical therapy. That might initially be more focused on pelvic floor muscle relaxation. Similarly for people who have trouble emptying their bladder, which is another pelvic floor disorder, or trouble with defecating, so not constipation, but literally their bowel movements feel stuck, we'll often recommend pelvic floor physical therapy. And what the therapist may work with you on is relaxing the pelvic floor a little bit better, because in order to empty your bladder or your bowels properly, a lot of things have to happen: brain signaling, nervous system pathways, smooth muscle contractions. But in addition, the pelvic floor muscles have to relax. And sometimes we just don't do that properly, and it can, cause pain, or it can make us not empty our bladder or bowels properly. So definitely different kinds of physical therapy, but again, an area where physical therapy is really, really, really beneficial.
And I don't know if you have an answer to this, more though, like a discussion of thinking of like, okay, so this affects half of the population. This is a pretty important part of our health. And like we discussed at the beginning of like, it's doing a lot of things. I feel like, why don't I know more about this? Like, how come I don't know what exactly symptoms are, what's happening? Of just hearing this term pelvic floor just thrown into the air. But like, what does that mean? Of like, it just feels like, I feel like I should know my own body better.
Yeah, no, I think that that's great. And I would be willing to bet if you compared yourself to your mom at your age or your grandma, they would know even less. So we're a newer specialty. So, maybe 30, 40 years ago, a lot of the people doing this urogynecologic work might have been just general OBGYN. So as a subspecialty, we're newer. We just got boarded as a specialty in 2013. And so I think that might be part of it. I think also women feel a lot of hesitancy to talk about these disorders. So I think women often find that they are embarrassed by them. I think that, often when you go to a doctor's appointment, it's so focused on prevention of diabetes and heart disease and things that are maybe more life-threatening that there isn't necessarily enough time left to bring up pelvic floor disorders, right? So I think it's a combination of factors. What I do think is really exciting is I think that women in our generation and younger are getting more and more comfortable talking about these disorders. And I think that our subspecialty is kind of growing. And so people have more accessibility to people like me, to urogynecologists who exclusively focus on these disorders. So, one of the biggest parts of my job, in addition to treating women, and one of the reasons that I love doing panels and podcasts and things for women, is because I view a really part of my job as just educating women about the pelvic floor, about the pelvic floor disorders, educating women about the fact that there are treatment options. So I think a lot of times people don't talk about these disorders or bring them up, especially older women, because they think that it's just a normal part of aging and it's something you're supposed to live with. So I just feel a huge part of my job is sort of spreading the word and educating women so that if women are bothered by these disorders, they will reach out to their girlfriends and talk about it, and their moms and talk about it, and ultimately to a specialist like myself to get help if that's what they want.
So in more cases than not, is this something that's fixable, of like at any age, this is something that you can work on? It's not something that you have to live with forever necessarily.
Yeah, absolutely. I mean, what I tell my patients is there's almost no one who I can't at least get better. That's not 100% true. There are some situations where nothing works, but that is a small minority of patients. So I would say, 99.9% of the time, we can do something to at least get you better, if not eradicate one or all of your pelvic floor disorders. So anyone who is bothered by something related to the pelvic floor should absolutely seek help. We should never just assume this is like a normal part of aging that I have to live with.
Yeah. So is there anything of maybe somebody isn't experiencing any hardcore symptoms yet, but they know, hey, I'm overweight, or I have a couple kids, or I'm pregnant, or anything like that? Is there any sort of like exercises or work that you can do to kind of either start to undo some damage, or any sort of preventative exercises?
Yeah, for sure. So when we talk about risk factors, there's sort of modifiable risk factors, and then there's risk factors you can't modify. So for example, you can't modify your genetic makeup. But if you're overweight, you might be able to lose weight and come back down to a normal weight. Similarly, if you're a smoker, smoking we know contributes to chronic cough, and also nicotine may have some other negative impacts on the bladder and or pelvic floor. If you can quit smoking, that might help. Childbirth, you can't really help, right? You want to have the number of children, you want to have that scrape. But like I said, if you know you're going to be high risk for a pelvic floor disorder, you might see someone like me and get plugged in with a pelvic floor physical therapist, or you might not even see someone. You might just go right to a pelvic floor physical therapist and work on strengthening the pelvic floor and learning to do those pelvic floor muscle exercises correctly, right? Because a lot of times when we send women out there to just go do their quote unquote Kegel exercises, women aren't really doing the right exercise. And it's not like when you're, personal training and you tell someone to do a biceps exercise and they can look down and see that their biceps contracted. You can't really do that with the pelvic floor. So for women who do have, risk factors, particularly unmodifiable risk factors, for sure, getting in early with a physical therapist and learning to do those exercises properly can only be beneficial. And then, like I said, anything you can do to prevent being overweight, smoking, chronic cough, things like that are modifiable risk factors, modifying those earlier will benefit your pelvic floor.
So is there anything, could you do some actual damage to yourself if, like, say you are, I'm sure you've heard this of like, whenever you're at a red light, do Kegels until the light's green again. Or something. Yeah. Are you hurting yourself if you're just like, I'm guessing this is what it's supposed to feel like?
Yeah. I think it's nice to even just have your OBGYN check to make sure you're doing the right exercise. Because one of the things I see is a lot of women, I tell them to do the exercise, and instead what they do is they push down on the pelvic floor, which is the exact opposite, which isn't what you want to do, right? That could only be contributing to more pelvic floor muscle damage. So it is important, like any exercise, to do the right exercise and use the right muscles. Otherwise, you might not be doing yourself benefit, and you might be doing yourself harm. So it's probably worth it to get checked out and make sure you're doing the right exercise. In terms of doing them at the red light, I have no problem with that if you can do them with some regularity. So like any exercise, we don't know the exact number, but what I'll typically say is if you can do 40 or 50, like 3 times a week, broken down. So what I'll tell my patients is 10 before breakfast, 10 before lunch, 10 before dinner, 10 before bedtime, Monday, Wednesdays, and Fridays. The only thing that I'm not a huge fan of is sometimes women will say, and I think this was an older thinking, but to try to hold your urine stream to contract your pelvic floor. And I don't love that because I think sometimes it teaches women to not relax their pelvic floor when they're voiding. And as I had said earlier, it's actually really important to emptying your bladder properly to when you sit down to relax your pelvic floor. So I don't love that, but otherwise anything you can do to do them with regularity, including the red light, I think is great.
So is this something, if somebody did want to like get the correct exercises, or do any sort of like just kind of the preventative work that we were talking about, is this something they can ask their normal OBGYN about, or is this something they need to see you about?
Absolutely. So I think if you're looking to make sure you're doing your Kegel right, you want a referral to a physical therapist, I think you can either just call up a physical therapist, you can call up your OBGYN, and certainly if you want a specialist to be the one to guide you, we are happy to do that. But I think whatever's easiest for the patient, if they can, get to their physical therapist directly or their OBGYN or to someone like me, all of those are appropriate.
So what are some symptoms that people should be looking out for to know, like, okay, this isn't just normal life, this isn't aging, or this isn't just, I have kids, this is how life is now, where they should, seek out medical attention?
Yeah. So our rule of thumb with pelvic floor disorders is, in general, if they bother you, no matter how mild they are, that is sufficient criteria to seek help. And symptoms to look for are, the leakage of urine without, warning or involuntarily, leakage of stool, recurrent bladder infections, trouble emptying your bowels or bladder, feeling a vaginal bulge or pressure in the vaginal area, pain with intercourse. And any of those, and that's not a completely comprehensive list, but it covers a majority of pelvic floor disorders. But any of those, if they're bothering the patient or if they just think there's something wrong with their pelvic floor, they should come on in, either start with your gynecologist or come right in and make an appointment with a urogynecologist, and we can help you sort out, is this related to the pelvic floor, and give you options about, what we can do to treat those pelvic floor disorders.
So if anybody has any like specific questions for you, or they wanted to specifically sign up for an appointment with you, just go right past the OBGYN. Is that possible? Can you just go through like the Christ Hospital website and shoot you an email? How does that work?
Yeah, absolutely. So they can just call our office to make an appointment. The only limitation would be if your insurance requires you to get a referral, then you might need to get a referral from your primary care doctor and gynecologist. But I would say in this day and age, primary care doctors and gynecologists are very well versed in when to refer a patient to urogynecologist. And that is our primary referral base. So if insurance requires a referral, otherwise you can absolutely just pick up the phone and call us. Or if you feel more comfortable because you already have a relationship with your primary care provider or your obstetrics and gynecology provider, you can definitely go through them as well.
Awesome. So is there any sort of advice that you would give anybody listening, or that you end up giving to all of your patients?
Yeah. So what I really want women to know about pelvic floor disorders is that they are very, very common. They're only getting more common as our population ages. And so I never want anyone to feel like they're alone or that they're embarrassed. I want them to know that there's people like me who specialize in these pelvic floor disorders. And if they are bothered, I really want them to feel comfortable reaching out to someone like me to get help. And I also want women to know that there is a whole variety of treatment options. So not everything is treated with surgery. For women who want surgery, there are often procedures or surgery, but for women who do not want surgical options, we often have a range of non-surgical options. So we can really tailor the treatment to what works best for the patient and their life circumstances and their lifestyle.
Awesome. Well, Dr. Shah, this was definitely very informative, and I hope that it helped a lot of people and maybe getting some further advice and maybe taking the next step or feeling better that they're not alone in some of the issues they've been having. So this has been fantastic. Thank you so much.
Thanks a lot for having me.
AmandaValentineBites.com